Gentlelady yields back. I now recognize Mr. Soto for his 5 minutes of questioning.
Thank you, Mr. Chairman. The Superfund law known as CERCLA has protected countless American lives. In 2024, we saw EPA advance new protections against two types of PFAS chemicals, PFOA and PFAS, widely used in consumer industrial uses. We've heard some of those uses today. These chemicals, unfortunately, have poisoned our drinking water in many communities, resulting in cancer clusters, low birth weight, liver disease, and more. We saw it particularly hurt our heroes in Florida, at Ocala, in the Florida State Fire College, where we saw chemicals and Firefighter suppressants that contaminated groundwater supplies. These included PFAS chemicals. So our firefighters sued because they were facing thyroid, kidney, breast, and parathyroid cancers. And last term, I was able to file a firefighter PFAS bill, and we're actually working on a new one. Ms. Donovan, have you heard from any firefighter families in talking with families across the nation about PFAS exposure?
Welcome back to my channel. The Superfund law has saved lives. And in 2024, the EPA finally moved to strengthen protections against some of the most dangerous PFAS chemicals poisoning communities across the country. These chemicals are everywhere in consumer and industrial products, and the result has been devastating. Contaminated drinking water has led to cancer clusters, low birth weights, liver disease, and long-term health damage. In Florida, the damage hit close to home at the State Fire College in Ocala, where firefighter suppressants polluted groundwater. The very people sworn to protect the public were exposed, and many later faced thyroid, kidney, breast, and parathyroid cancers. Firefighters were forced to sue just to get accountability. This is why legislation targeting PFAS exposure matters. This isn't abstract policy or environmental theory. It's about firefighters, their families, and communities living with the consequences of chemical exposure, while regulators and manufacturers looked the other way for decades. The question now isn't whether the harm exists. It's whether leaders are willing to listen to those families, take responsibility, and finally put public health ahead of corporate convenience.
Yeah, and it's devastating to hear the stories, to listen to a grown man break down. A grown man that you know is incredibly brave because they'll run into a burning building just to save a kitten or something. And I have a friend, and her husband is a firefighter in Nantucket, and he developed testicular cancer. And she was telling me that on top of struggling through the diagnosis, they also found out that there was further contamination of their drinking water, and it felt like a double cumulative whammy. But they were trying to figure out if he should stop being a firefighter because the risks were so high. He's not afraid of fighting a fire. He's afraid of dying of cancer because he's not being protected. He's not being protected in the most basic way with clean gear, with clean water, and with making sure that the products that are burning in the home are not creating a chemical soup that he's enduring. You know, should he quit mid-career and find something new just because of this? In our area, our firefighters were incredibly concerned as well, and they've been pushing back. But the problem in North Carolina is that our firefighters don't even have good medical liability opportunities. So they're at an increased risk of getting cancer. And in North Carolina, they were having to fight the state, not to stop their exposures from PFAS, but just to even get a fair shake on insurance claims.
Well, thank you for that. And I had to work on those issues on the state level and on the federal level with a cancer presumption. But we also see in the foam them now taking PFAS out of it. But we have a duty, members, to our local heroes to be able to get this done. Mr. Meehan, we saw in the infrastructure law under Biden $50 billion for the water infrastructure, including the state revolving fund, which so many local water utilities utilize. We've been able to work with to secure over $500 million from that for Toho Water, Polk Water, for OUC in my area to help with clean drinking water. But we've seen the Trump administration propose a 90% cut to the state revolving fund for 2026 from $2.8 billion to $280 million. So as we're talking about trying to protect clean drinking water from PFAS and other chemicals and making sure our utilities have the money they need, what effect would that be if you saw the state revolving funds decimated by 90%?
Well, it'd be entirely negative. I was earlier in the year had a conversation with the general manager of Milwaukee utility, and they've had a pretty good program to remove lead service lines, and they depend on the SRF. And they said without the IIJA or BIL, they would.
The infrastructure law, just for my constituents, right?
Yeah, without the money, it wasn't going to happen because, they've got a pretty, a ratepayer base that's not exactly affluent. And so, yeah, it would retard things. Again, it will default again to the ratepayers. And so then you get into a local political discussion of how much you can afford to raise the rates and at what pace. And of course, if you've ever been to a ratepayer hearing, you hear a lot of conflicting views about where the rate should be.
And so if Congress delivers on our state revolving funds, this will keep water utility rates down.
Although I will, and this will not be a popular statement, the earmarks are really devastating the SRF's program because they are grants. They are not loans. They do not revolve back into the ones. And there's 30 states now that are getting less money from the SRF program because of earmarks.
So we got to improve that. Thank you.
What you hear from firefighter families is heartbreaking and infuriating. These are men and women brave enough to run into burning buildings without hesitation, yet they're breaking down in tears because the real threat isn't the fire, it's cancer. One firefighter in Nantucket developed testicular cancer, and while his family was still processing that diagnosis, they learned their drinking water was also contaminated. Imagine that moment. He's not afraid of flames. He's afraid of dying because the system failed to protect him with clean gear, clean water, and basic safeguards against toxic chemicals. Firefighters are being forced to ask an unthinkable question. Should they quit mid-career just to stay alive? In places like North Carolina, it gets even worse. Firefighters face higher cancer risks but don't even have fair medical liability or insurance protections. They aren't fighting to stop exposure anymore. They're fighting the state just to get their claims taken seriously. That's not support. That's abandonment. We talk about honoring first responders, but when it comes time to back that up with policy, too many institutions disappear. Clean drinking water is a critical part of this fight. Federal investments through infrastructure funding and state revolving funds have helped communities remove toxins and protect public health. Cutting those funds by 90% would be disastrous. Water utilities rely on this support to replace contaminated lines and prevent dangerous exposure. Without it, the costs don't vanish, they get dumped on local ratepayers, families who can least afford higher bills. That creates political chaos at the local level and leaves real health threats unresolved. This is about priorities. If Congress follows through on funding water infrastructure, it keeps utility rates down and protects communities from toxic exposure. But when funds are slashed or misdirected, the system breaks down and the burden shifts to firefighters, families, and taxpayers. Our local heroes deserve more than praise. They deserve protection, accountability, and policies that put public health first.